So Avapritinib is a potent c-KIT inhibitor. The data from the PATHFINDER and EXPLORER trials have looked at the efficacy and the safety profiles. And if we're looking specifically at safety profiles, I think we need to look at the registration trial, the PATHFINDER trial, looking at the 32 patients that had an interim analysis. And from those patients, of the 32, 6 patients needed to have some of the drug withdrawn. There were no bleeds. I think the one thing I have to point out is there were no treatment-related deaths in that particular trial, which was a registration trial. Patients started with a dose of 200 milligrams of Avapritinib once daily. And it's really important to remember they needed to have a platelet count of greater than 50 times 10 to the 1,000. And the reason for that is that the protocol amendment was made as intracranial bleeds that were noted in the EXPLORER phase 1 study were associated with a low platelet count. So since that amendment's been made with a platelet count of a requirement of above 50, there were no intracranial bleeds resulting because of that platelet threshold. There was one intracranial bleed reported, and that was before the protocol amendment had happened. So important to know, no treatment-related deaths, no intracranial bleeds were noted with a platelet count above 50. And secondly, there were 2 or 3 patients with mild cognitive impairments, which has been noted, and they present themselves as mild memory impairment, word finding difficulties, and they seem to improve when patients have a lower dose. They were more noticeable in the EXPLORER trial when there were higher doses of 300 milligrams. If you reduce the dose, they don't seem to be as noticeable in patients or reported by patients. And then, as with all TKIs, all patients will get periorbital edema and some peripheral edema. And I think one of the messages that with a low dose, if periorbital edema is only mild, then it's kind of a consequence of the TKI and it's doing its work. But if you have significant periorbital edema, reduced dose leads to a reduction of that.